there have been lots of quotes over the years from famous wealth physicists and all sorts of people saying, if you can't measure it, if you can't turn it into numbers, we don't know anything about it. Okay, and I kind of agree with that. Measurement is the key to trying to advance our knowledge about the interplay between nature and nurture. If I can't measure events and see on average effects and tell the stories of whether it's just chance or otherwise, I can't improve it, I can't intervene, I can't do something about it or make a policy. And that's very, very important. So, and this is where I turn to what's happening in Bristol. So children of the 90s, 14,000 mums in 1990, 1991, 75% of all the pregnancies in that period, recruited, followed up through time, still going strong. Extraordinary study because it measures so much about people's lives on such an appropriate scale. Those types of studies, in fact in Bristol we're blessed because we also have UK Biobank taking participants into the study as well. We now know that we've got more than 1,000 people in both studies, and we can link the two together. I mean, we've got this hub of fantastic science in Bristol and people being involved in science. And without having participants involved in science, there is no material to work on. There's no way of testing the nurture versus the nurture. Okay? There's no way of thinking about interventions or policies that do something and change people's lives. So being involved in those studies allows people like me and the researchers who operate on the data, I should say that something like Children of the 90s, several thousand publications in the last 4 years, 800 researchers internationally on the books using the data and the sample. I mean, it's radical scale of contribution from a study that's based in Bristol and that I don't control at all, the participants control, right, with their interaction with the study. So that's super important. I can't impress upon you more how important that is. Provision of material, allowing measurement, getting involved. Now we've got, I don't know, did anybody get the papers that came round, those little things? Most people? Right, so I'll give you an acid test of how important measurement is. So if you're brave enough, put it on your tongue now. It's not psychedelic, don't worry. You're going to survive. Get it moist, back of your tongue or right in the middle. You can shut your mouth, doesn't matter, just don't swallow it. If you swallow it, it won't kill you anyway. Now then, just let it get moist for a while and I'll tell you the story of what it is. So one of the classic clinal phenotypes in humans, by clinal I mean it varies in frequency by geography, is taste. On that piece of paper is a chemical which is the ligand for a very specific receptor on your tongue. Okay, now some people carry a genetic change, which means that they can't taste it. I can't taste it, it's just like a bit of blotting paper to me. Other people think it's horrible, right? So just, if you've been brave enough, how many horribles and how many, right? So the majority horribles, right? So in the UK, right, it's about 60-30 split, horrible to not horrible, okay? Which is what we're seeing in the room in real time. Now, the reason that that experiment works in real time in this tiny little collection of people is because I've just performed the perfect measurement. The ligand, the gunk that stimulates a specific receptor on your tongue. Compare that to a study that I might do in the general population based on questionnaires. When I ask you how you feel about it, maybe, if you remember doing it 2 weeks ago. That generates noise. It makes a poor measurement. It means I need big samples. Again, why are Children of the 90s so important? Because it's a big sample that runs through time and it gives me precision in the absence of the perfect measure that we've just used. Okay, so involvement in people getting involved in science, helping us out, and believing in the study and its security and its governance and all of that is absolutely critical.